Hello, and thank you for your interest in best practices in engaging encampments in California. My name is Megan Marshall, your Executive Officer of the California Interagency Council on Homelessness, and I will be narrating this pre-recorded webinar. We will begin by providing a brief overview of the August 22, 2024 Supreme Court decision and Executive Order N-124 webinar, followed by recommendations of essential partnerships and best practices in engaging encampments, and conclude with next steps and opportunities to partner with CalICH. On August 22, 2024, CalICH hosted over 350 partners from cities and counties across California to provide an introduction to CalICH and an overview of Governor Newsom's Executive Order N-124. As stated in our mission, CalICH is a statewide facilitator, coordinator, and leader for policy development and research for state and local jurisdictions in their work to prevent and end homelessness in California. The primary goal of the August 22nd webinar was to clarify what the executive order is and is not, and how the order impacts city and county partners. The executive order is a directive for state agencies and departments to develop humane and dignified policies to urgently address encampments on state property, including by taking necessary and deliberate steps to notify and support the people inhabiting the encampment prior to the removal. The order is not an order to immediately clear all encampments on state property or to issue criminal citations for camping on state property. As we move through this webinar, I invite you to consider these questions and to flag those you don't have an immediate answer for. What resources does your community have to effectively address encampments? Are they short-term, long-term, or permanent? Do those resources follow Housing First principles? Are those resources limited to certain populations? How are those resources accessed? Who is your local lead on homelessness? If there is more than one lead, who is responsible for what and when? Is this different if you are a small city versus a big city in the same county? When does an encampment become a priority for your community? Where are the encampments in your community? Are they located in an area where its members are in imminent danger due to natural disaster or other emergency? And in general, who is living in the encampment and who are the essential partners to addressing the needs of those members? This next section will focus on partnerships that are essential for effective encampment engagement. While many of the partnerships we will highlight will be well known, I would encourage you to reflect on who these partners are in your community and to establish a connection with any you are unfamiliar with. As we move through this section, please consider how your community responds to encampments. How do you define an encampment? Do you have a dedicated encampment response team or teams? I'd like to begin this section with a brief overview of the distinction between cities and counties, with a particular emphasis on service responsibility. California has 483 cities and 58 counties. All California residents live within the boundaries of a county, and the vast majority within an incorporated city. Cities are created by constituents and are governed by a city council. Counties are created by the state and are governed by a board of supervisors. Cities are responsible for residential services such as garbage pickup, code enforcement, and animal services and regulation. These services are limited and specific to the constituents within the geographical boundary of the city. Counties are responsible for administration of the majority of state mandates, including entitlement programs such as welfare benefits and behavioral health services, as well as safeguarding the public's health. These are often referred to as county-wide services and are available to incorporated and unincorporated cities. I'd like to note here that there are rare and unique circumstances in certain California jurisdictions. For example, in the city of Berkeley, which is in Alameda County, acts as its own public health jurisdiction. When we discuss partnerships, it is important for cities and counties to know who one another are and what each is responsible for. This slide will focus on essential partnerships that are common in communities. For those of you who are part of an integrated health and human services county, many of these services may exist in your very department. In contrast, for those of you who are not part of an integrated model, these services may exist across 3 or more departments. In either instance, it is important your encampment engagement include partners from human assistance or social services who administer welfare entitlement programs such as CalFresh, CalWorks, General Assistance or General Relief, and Medi-Cal, as well as health services such as behavioral health and public health. City partners, it is important you know which model your county ascribes to and how you can partner to incorporate those services into your encampment response. Other common partners in encampment responses include continuums of care and community-based organizations. While some local government entities act as the COC, most COCs are operated by nonprofits. COCs are contracted with federal, state, and local partners for designated projects and services. Similarly, CBOs are contracted with government partners for interim and/or permanent housing, outreach, case management, and navigation. It is important for city and county partners to be familiar with what services are contracted for and what is directly administered by local government. This slide will focus on essential partnerships that are often perceived as complicated in terms of their incorporation to engaging with encampments. The reality is, entities that are responsible for enforcement and oversight interact with persons experiencing homelessness and encampments on a daily basis, and therefore, it is critical that your homeless services system is familiar with and regularly engage with these partners. These enforcement and oversight partners include Adult and Child Protective Services, Animal Control, County Sheriff Departments and City Police Departments, Code Enforcement, Emergency Management Services, Fire, Park Rangers, Port Authorities, and Public Works. I'd like to highlight Code Enforcement as an enforcement and oversight partner for your consideration. Code enforcement is a function of local government is a function local governments perform that constituents consider important for accomplishing community goals, such as protecting property values and the environment. Traditionally, it has been a process whereby local governments use various techniques to gain compliance with duly adopted regulations such as land use and zoning, health and housing codes, sign standards, and uniform building and fire codes. Two common universal codes that intersect with the homeless services system concerns the length of time a vehicle can be parked in one place and the removal of inoperable vehicles. It is important that your local code enforcement agencies are familiar with opportunities to connect persons who use their vehicles as their primary residence to the greater homeless services system. Who are your code enforcement agencies? How do they respond to community calls for service for vehicles that appear to be abandoned or inoperable? State and state-adjacent partners include CalICH, Caltrans, Housing and Community Development, and Managed Care Plans. I'd like to highlight MCPs as a state-adjacent partner for your consideration. The California Department of Healthcare Services contracts with 24 plans to provide healthcare services to Medi-Cal beneficiaries. These plans deliver services in all 58 counties using one of 5 models to deliver care. MCPs are actively seeking effective ways to partner with the homeless services system to better address the health and social needs of persons experiencing homelessness. In particular, under CalAIM, California's Medicaid Transformation Initiative, MCPs are encouraged to provide new community support services, including, for example, housing services and medically tailored meals to help address members' health-related social needs. MCPs have flexibility regarding which community supports to offer and how to partner with homeless service providers to successfully provide these services. What model of managed care does your community use? Who is or are your MCPs, and how can you ensure that they are part of your response to addressing encampments in your community? This next section will focus on best practices that are essential for effective encampment engagement and will highlight tools developed by our partners at the United States Interagency Council on Homelessness, or USICH, and at UCSF. As we move through this section, please consider which of these best practices are employed in your community. Are they effective? How? Are they incorporated across your community? The overall intention of USICH's 19 strategies to address encampments aligns with the Executive Order N-124's call to develop and implement humane and effective responses to encampments on public land. Based on what is working well in communities across the country, USICH's guidance targets public leaders in cities, counties, states, and federal agencies and serves as an update and expansion of the 7 principles for addressing encampments that USICH published in 2022. This new guidance was developed with input from people who have experienced homelessness, national partners, and experts from multiple federal agencies. To effectively resolve encampments, communities must use evidence-based strategies to collaboratively, equitably, and humanely address the housing and service needs of people without homes, even when housing is not available. When an encampment is prioritized for closure, the process must be implemented in a humane and trauma-informed way, and the goal must be to connect every person to housing and services to help them overcome and avoid future experiences of homelessness. The 19 strategies are organized under 6 categories. Those are equity, crisis response, collaboration, housing and support, data and evidence, and prevention. For more information on these strategies, please visit USICH via the link embedded in the underline header of this slide. The UCSF Benioff Homelessness and Housing Initiative, or BHHI, has developed 2 tools to help communities prioritize and resolve encampments. The tools are designed to help communities balance competing priorities and issues and to address unsheltered homelessness in a sustainable way. They are intended to be used together to enhance the effectiveness of the encampment resolution strategy. The first tool, which is the focus of this slide, is the encampment prioritization tool. This tool is intended to help communities balance the needs of persons in encampments, local businesses, and neighborhoods with a shortage of housing and shelter resources. The tool considers factors such as population needs, public health, and location. It provides a prioritization chart to help communities make informed decisions. The second tool is an encampment resolution guide. This tool is intended to help communities identify and assess encampments and provides resources to address them. The guide focuses on housing people first and reducing the number of people experiencing unsheltered homelessness. For more information on these strategies, please visit UCSF via the link embedded in the underline header of this slide. In the coming weeks, CalICH will deepen its work in best practices with state agencies and departments as they develop and implement their encampment response policies and procedures. If you are a city or a county who would like to be featured in a 3rd webinar focused on highlighting communities of practice, please email us at calich@bcsh.ca.gov. Again, thank you for your interest in best practices in engaging encampments and for your commitment to this important work. Thank you.